Hello, I am Dr. Venugopal. I am the chair of emergency medicine in Maitra Hospital, Kozhikode. And also, I am a visiting consultant in Malabar Medical College, Ullieri. Here, this is the topic that is promoting safety campaign around first responders awareness and EMS engagement. It was the topic presented in National Industrial Emergency Medicine Conference of this February in Ahmedabad. Why this topic is important? The first responders, they can be paramedics, they are EMTs, they can be nurses, they can be emergency physicians, firefighters, or the police. Whatever the cadre, they are operating in a very unpredictable, high risk environment. So, protecting them is not only a moral obligation, but it is also essential for maintaining the resilient emergency system. So, I am handling this topic in 5 headings. First, the physical and scene safety related risks. What are they? The sometimes our first responders coming across with the road traffic collisions during on the roadside, and sometimes they coming across the situation, violent situations intoxicated patient, a patient with a psychiatric illness in a violent behavior. Again, they involve in a domestic disputes. Very often, sometimes we may also coming across in a situation like a structural collapse or a fire, even an explosion, and even an electrocution and hazardous material exposure. And sometimes we may coming across the extreme environmental situations like heat stroke, dehydration, hypothermia. The how we'll handle, what is the mitigation strategy for this kind of situation? First of all, we must use safety first protocol. Make sure that your scene is safe. If the scene is safe, don't enter this. Always look into is the safe to approach. Then always wear a very high visibility reflective personal protective equipment, and if required, use that ballistic protection whenever is indicated. And always do the coordinated work with the police in a volatile situation, and also do a regular mock drills in disaster management and mass casualty protocol, and also in how to approach the dangerous scenarios like these highly volatile situations. The second scenario is the biological exposure, particularly the infection and other areas. We are the health providers, we are at risk for bloodborne pathogens, particularly hepatitis B, hepatitis C, and HIV. And again, the airborne infection is very rampant. Patient with TB, influenza, etc. And we were very much worried about this in the COVID period. Once the COVID is out, we are still back to the original state. We are much worried about. Very often we will overlook this kind of exposure risk, and very often we are prone for needle stick injuries and sharp injuries, and we are forced to do certain procedures like intubation, suctioning, etc. These are highly aerosol producing. If you are not wearing the proper PPE, you will also be a culprit. The second one, the mitigation of such program, such exposure is, use the strict PPE compliance and do the follow vaccination policies. Do vaccinate ourselves, whatever is possible, either hepatitis vaccination or the influenza vaccination, whatever it is. And whenever the needle stick injury is like, we have to report it and then follow the needle stick prevention strategies and use the new devices which will not cause the needle stick injuries. Even the safety needles are there, safety cannulas are there, you use that. Unfortunately, if you occur an exposure, move for the post exposure prophylaxis properly, test your blood and do that proper root cause analysis and correct it. And for this again, you need a simulation based infection control training rather than simple PowerPoint presentations. The third category is the psychological and emotional hazards. This is the most common challenges, including, the healthcare providers are repeatedly exposed to the death scenario, particularly the children and the vulnerable groups. And again, moral injury and compassion fatigue, we feel like we are losing on the field. Again, the shift related issue and the sleep deprivation, and lastly the total burned out, you may lead to the depression. Sometimes you are very prone for the post traumatic stress disorders, and sometimes end up in drug misuse, substance misuse. So what are the protective strategies? Protective strategies include, do a proper peer support program, then do a structured debriefing, do a psychological safety model has to be used, do a confidential counseling, arrange a confidential counseling access for the victims, and also do the proper duty rotation and implement the fatigue management policies. This is particularly relevant in drivers who are working in ambulance, etc. The ambulance is in one area, like also mismatch is happening, particularly when they are shifting in a long shift, like 500 kilometers, etc. For a critical transport, there must be two drivers. Like the long buses, when driving, they have two drivers. They will have the strict shift duty. That is true for the ambulance people also. This is true for the EP and EMS accompanying the patient as well. Another hot issue even across India, particularly in Kerala, there is a violence against healthcare workers. This is something a passion nowadays, fashion for the public. The incidents of assault in emergency departments are increasingly globally, and some of the contributing factors including overcrowding, long wait time, then substance intoxication, misinformation and mistrust, and inadequate security in the emergency room. And 80% of the issues arise from the communication related issues. And on top of that, aware you that there are specific mafia groups are working in the community. Even that include doctors, police, and even judge and advocates, etc. They will create a script and they will create a issue in your emergency room or in the scene, but their simple reason they want to get it money out of that. And so they will share it. So beware of such kind of mafia group existing in the community. So what you want to do, in your institution should have a zero tolerance institutional policy. And also we have the strict screening on the emergency, the screening in this scenario, and also there is an emergency panic button, and then there will be the specific staff training how to do a verbal de-escalation strategies. And there is also make your ED and other areas with a good visibility, and also a safe this architectural design in such a way that there will be safe exits. And also there should be the code white scenario, code white scenario or the code gray scenario. It's almost of the accredited hospital. This system is there. Whenever there is a violence occur or a mass gathering is a mass violent people are occurring, you can put it a button or you can call the code white. Immediately the trained people will gather and they will manage the scenario, so you will be much more safe on this scenario. So what do you want to do to manage all these? You another okay fine. Then another one is the occupational related ergonomic injuries during our profession, particularly the back injuries during from the patient lifting. Again, the repetitive strain from prolonged CPR, hearing loss from the sirens. Again, sometimes you are exposed to chemical exposed during your fire rescue and other areas. So what you want to do, have your occupational ergonomic injuries solutions are you have the powered structures and the lifting aids now. Use it that rather than using an obsolete one. Do a team-based lifting protocol. You do some fitness training and condition programs, and also use your ED and ambulances in an ergonomic redesign in such a way that it reduce your occupational injuries. So what is the system recommendation for these issues? I would suggest the first safety, clear the safety culture. The leadership must prioritize the responder safety equally to the patient safety. Similarly, there will be a mandatory monitoring system and encourage the transparent incident reporting without blame. You should not go for a movie. You should not go for a blame game. Rather than it should do a proper root cause analysis and support those who are involved in, and then save them. Another one a regular competency training. So this is this kind of policies are usually the highly vaporizable. So what you want to do repeated and training, particularly in trauma, airway crisis and hostile scenarios. Again, do the insurance and legal protection framework for our people, and also ensure that the medical legal compensation and its clarity. And do provide the adequate mental health support and mental health integration. This is something lacking in Indian scenario. So finally conclude this. Before concluding this session, you can see these two pictures. This is Vandana Das, a young doctor who was killed, attacked by the person next to him. He was a psychiatric patient. This young doctor was stabbed by this man in an emergency room. He has taken the scalpel from the dressing tray and stabbed her on the chest and other thing. What they did, that emergency department referred this case to a district level hospital. From there, the doctors intubated her and then transferred to a medical college, a tertiary level hospital. En route, she died, and later shows the postmortem. She died due to the tension pneumothorax. What the people forget, they intubated, but they forget to put it as chest tube. Because after intubation, they inflating the bag, this simple pneumothorax might have converted into a tension pneumonia. That may be the reason, but this should not be happen. Here it is a safety failure, management failure, multiple issues happen. This is happened in Kerala only, as they are supposed to be number one in many areas. So what I want to tell here is the first responders, operators at fragile interface between chaos and the care, whether on highway, in disaster zone, or in a crowded emergency department, or in unstable home. They operate in an unpredictable environment where the risk is inherent. So Ensuring their safety is not optional, it is a fundamental right for the patient's survival and system and for the ethical healthcare system. And what required is our first responders must be aware of this kind of scenario. So we need to promote very active and very focused first responder campaign among our people. Thank you for your patient listening. You can access my all profile in docvenu.com. Thank you so much.